Well, a new study released by the CDC on September 26th, that's 4 days before we learned of patient zero in Dallas. That new study posits that the number of cases in Liberia and Sierra Leone are growing at a much faster rate than previously thought. And of course, it is not under control, it is ever expanding.
Today, we are providing the information that an individual traveling from Liberia has been diagnosed with Ebola in the United States.
Hey, Dr. Colbert here, and there's a lot of fear concerning the Ebola virus, so I'd like to give you some facts so it can relieve your fears. First of all, approximately 21,000 people are presently infected with the Ebola virus, and the CDC predicts that by January of 2015, 1.4 million people will be infected. Now that's a huge jump in just 3 months. In fact, that's the entire population of the state of New Hampshire.
Now, the latest on the Ebola outbreak in West Africa, which is moving faster than efforts to contain it. The disease has struck hard in 3 countries, Guinea, Liberia, and Sierra Leone, which is the epicenter. A Liberian government official who had flown to Nigeria's largest city, Lagos, died of the disease in a hospital there. 2 American aid workers infected in Liberia, 33-year-old Kent Brantley and 59-year-old Nancy Wright-Ball, will be sent home for care at Emory University Hospital in Atlanta. It is the first time any Ebola patient has been sent back to the U.S. for treatment.
Outside the John F. Kennedy Hospital in Monrovia, Liberia, 20-year-old Ibaga Stiwo is sick.
In Dallas, there is no sign Ebola is spreading, but the fear of Ebola definitely is.
Stay with CBS 11 for continuing coverage of Ebola.
The first case of Ebola in America dominates on TV, on radio.
Government and health officials in Dallas are trying to reassure the public that...
And online, like this post on Twitter. Everyone in Dallas better get to their nearest hospital and quick. I don't care if you feel fine. I want this thing contained. News that several children had been in contact with the Ebola victim and then attended area schools has frightened many parents.
We're questioning right now as we're walking to school whether I'm going to let him go, and I'm heading towards not letting him go to school today.
She's not alone. Attendance at the affected schools is down.
For those 5 schools, it's 86% attendance. It's usually around 95-96%.
You might expect Ebola fear, concern of an Ebola outbreak, would have people flooding emergency rooms and clinics. Health officials say that hasn't happened so far.
Do you worry it could spread?
Yes, I am worried about the spread. Because kids go to schools, everybody go to church, everybody go to market.
Not everybody's Ebola fear is the same. For instance, in this community, closest to the patient now being treated, it's mostly immigrants. Their fears are, what if there's a stigma attached to the disease? What if they were banished? What if they were quarantined? How would they go to work? How would they pay their bills? How would they survive? That really scares them. To try and calm public concerns and provide answers, Dallas activated its Emergency Operations Center, normally reserved for disasters. But it got off to a rough start with frustrated reporters.
Wouldn't you want to keep them all in one place? Keep them in the apartment.
Fear has even come to the fair, as in the State Fair of Texas, triggering concern it could hurt attendance. Extra hand sanitizer has been put out for visitors. Even iconic Big Tex has added a line to his usual Texas howdy.
Always wash your hands before eating.
The Liberian Daily Observer, which is the largest newspaper in Liberia, just published an article on their front page with the headline, Ebola AIDS manufactured by Western Pharmaceuticals, US DoD. The article basically accuses the U.S. of manufacturing this Ebola outbreak in what they call an American military medical industry scheme to use Africa as a testing ground for bioweapons. The article was written by Dr. Cyril Broderick, a professor who's taught at different colleges, including the Agricultural College of the University of Delaware. In the article, he urges African leaders to not let their people be Western guinea pigs. He accuses the Centers for Disease Control and Prevention, Tulane University, the U.S. Army, and others as all being connected to this bioweapons testing plot.
And now to the latest on the first case of Ebola diagnosed in the United States. New today, we know the patient's name now. He's Thomas Eric Duncan. He remains in serious condition this afternoon at the hospital in Dallas.
We also learned today that Duncan came into contact with as many as 18 people between the time he left Liberia on September 19th, including 5 Dallas students from 4 different schools. He arrived in Dallas via DFW on September the 20th. And we've just learned United Airlines now believes Duncan flew to DFW from Washington Dulles Airport on flight 822. Governor Rick Perry held a news conference this afternoon in Dallas. He says those students are being monitored at home, but the governor also says so far none of them has shown any symptoms.
These children have been identified and they are being monitored, and the disease cannot be transmitted before having any symptoms.
The CDC is also monitoring Duncan's family members and the ambulance crew who transported him to the hospital. How Duncan's case has been handled is raising some questions about Texas Presbyterian Hospital in Dallas and what they knew. The doctor from the hospital says Duncan walked into the ER on September the 26th. A nurse asked him if he had been out of the country, but that information apparently was not relayed to other medical personnel. Duncan did have a blood test, but not an Ebola screening, and was sent home with antibiotics. 2 days later, he was rushed to the ER with a high fever and nausea. Yesterday, doctors confirmed that Duncan tested positive for Ebola, and he is now in an isolation unit.
The fear of Ebola in affected countries and beyond is palpable. A man in Guinea suspected of having the gruesome disease was left lying in a city street for hours. Passers-by too scared to help, medical resources stretched thin.
Let them come and take him from here, because we are afraid.
More than 930 people have died in the outbreak. The military now helping combat the spread of Ebola in Sierra Leone. Liberian soldiers are clamping down on travelers. No one with a fever allowed in or out of the country. And in Spain, health officials reassuring the public there is little risk of Ebola spreading from an infected priest evacuated from Liberia, now in isolation at a Madrid hospital.
He is stable with fever, and the most important thing is that Father Miguel is not hemorrhaging. This is a sign of a positive prognosis.
The World Health Organization will soon decide if the Ebola outbreak is an international public health emergency, which could initiate a more global response. The CDC is operating on its highest alert level, the first time since the 2009 swine flu pandemic. The agency's director briefed representatives on Capitol Hill.
We, with our partners, have been able to stop every Ebola outbreak to date, and I'm confident that if we do what works, we will stop this one also. But it won't be quick, and it won't be easy.
Dr. Thomas Frieden says tried and true infection control methods, diagnosis, isolation, and tracing patient contacts are the best way to end the outbreak. Cindy Sharp, Associated Press.
As the medical world continues to grapple with Ebola, there are growing calls for experimental medicines to be used more widely. 2 American aid workers infected with the virus appear to be improving after receiving an unapproved medicine, ZMapp, ahead of their evacuation back to the United States.
This is an emergency compassionate use situation. This is not a well-controlled laboratory study. A lot of work remains to be done to see how it worked and why and how quickly. The apparent speed of recovery was faster than I would have expected, so there may be a lot of things that we still don't understand about the virus.
The antibodies were originally harvested from mice that had been injected with parts of the virus. Experiments on monkeys suggest the antibody cocktail may reduce fatalities when given after exposure to the virus. The proteins are then grown in specially modified leaves of tobacco, which act like a photocopier, reproducing larger amounts.
I do agree there's no vaccine. Treatment is experimental. The real way of stopping it is by transmission of the virus, which we know quite well how to do. It's just spreading that message and then providing basic supportive care to people who are being treated at the moment. What we must remember, it's a very isolating and stigmatizing disease, and people deserve to be treated with care and concern, which is what we're all committed to.
The Spanish government is sending a specially equipped plane to Liberia to evacuate a priest who is infected with the virus in the capital city, Monrovia. The World Health Organization will announce on Friday how it plans to slow down or halt the global spread of a virus that has claimed 900 lives in West Africa since February.